Good morning.
Yes, the theme is kidney health, for all. I mean, what do you want people to know that, well, they might not know about their kidney, especially how to keep the kidney safe and healthy?
Well, just like the theme for this year's goal, it is kidney health for all. And we are trying to bridge the knowledge gap. What does this mean? Kidney health for all is about the health of the people as far as their kidney function is concerned, how to manage it themselves, how to have knowledge and pass it across to people. Some majority of the people don't even know that kidney disease exists until probably when they are now at the last stage and they now present at the hospital and somebody is now telling them, oh, you have end-stage kidney disease, you are going to have dialysis, or you are going to have a kidney transplant. So that may be the first time somebody is being acquainted with the term kidney disease. So the advocacy now worldwide, nationally, is kidney health for all. That is your kidney for yourself, by yourself. So we all need to know, and we have to bridge the gap. Community participation, awareness, health education program, all these are anticipated.
Yeah, you talked about kidney disease, and I mean, what are those things that could lead to kidney failure? How can we prevent that from happening?
Well, I'll start by saying this. With all sense of purpose, I'll tell you that the kidney is the most important organ. You ask me why? 25% of what the heart pumps, we call it cardiac output per minute, goes to the kidney. You can imagine how important that organ is. Out of all the organs in the body, somebody receives 25% of the allocation every minute. Okay. So when such an organ, when it is being insulted, it fails. And this could be acute or it could be chronic. Just like the name sounds, acute means an insult that just suddenly occurs to the kidney. And this could arise from, and that's why we are doing all this advocacy. Look at all these pregnant women who go and deliver at hospitals where we don't have qualified hands. They can have preeclampsia, they can have problems post-surgery, they can have infection called sepsis, and this can tilt them to an acute insult. Oftentimes, if they present early to see specialists, it is usually reversible in acute. In chronic, just like the name sounds, it will have been on for a while. And causes of this are enormous. And very popular in our environment here is number one cause, hypertension. Of course, worldwide, it is diabetes mellitus. But in Nigeria, our own country, number one cause is hypertension. By the time you take an average adult in Nigeria, at least 7 out of 10 adults, we have background hypertension. So how do you manage this hypertension? What is poorly controlled? The end product of that is kidney disease. Of course, among other things, I've mentioned diabetes, I've mentioned HIV infection, hepatitis infection, be it C or be it B. Of course, very common again in this our environment is these herbal remedies. And all these things are so common now because they are being sold everywhere. And majority of these things, I've said it on program here, because people want to sell these products, know what to put it there. They'll put aphrodisiac. They put a lot of CNS stimulants. So when they put all these things, it stimulates those people that are taking. They feel, oh, I feel okay whenever I take them. All these products, Jekomo, Jewaribo, those people make a lot of money. And people drink it on a daily basis.
But those products too, they display NAFDAC numbers. Does it not mean that it doesn't mean that NAFDAC is not aware of the implication, the health implication of?
My dad, we were both born in this country.
Okay.
For the fact that something has a NAFDAC number is inconsequential, because majority of these products actually have nephrotoxic materials. Okay. So I wouldn't want to go to why they are eventually being certified. So that's another topic for another day, because some of them also pass through the SON, Standard Organization of Nigeria. But as far as I'm concerned, I will limit my own to what is in those products and how they eventually lead to kidney disease. So a lot of them contains what we call nephrotoxic products.
So what are the symptoms, to watch out for? leading to kidney malfunction? How can people know that their kidneys are safe and healthy? And by the time, the early detection, basically, of kidney disease?
Well, I don't want people to wait until they start seeing symptoms.
Okay.
Because the truth of the matter is, by the time you start seeing symptoms, the problem may not usually be reversible. As a specialist, the advice I'll give is, number one, once you are getting to at least age 40, your normal checkup should be at least 3 times in a year. We have money that we use for other things.
Okay.
So what does it cost us to use our money to check ourselves? Okay. We don't have to be sick before we present at the hospital for routine checkup. So I'll start from there. But when you do your routine checkup, kidney function test is part of a routine checkup. Because by the time you are waiting to start seeing symptoms like, oh, bloated face,
Okay.
abdominal distension, reduced urinary output, you just find out that, oh, you are not urinating frequently like you used to do. Better still, you now found out that your urine is foamy. By the time the urine becomes foamy, that tells us that there is protein in that urine.
Okay.
And statutorily, protein should not come into the urine because the way God has made us. So there is a barrier. It's called the glomerulus. It's meant to filter. Okay? So naturally, there is a limit. So it shouldn't get into the urine. But so don't wait till you start seeing those end. Because by the time you manifest those, you can even see blood in your urine. You can start seeing rash on your body. So don't wait till then. Once you have hypertension, treat your hypertension properly. If you are diabetic, treat your diabetes properly. Go to hospitals where you have doctors who are knowledgeable enough to counsel and to do early referral. Before I let you talk, I will say this. A younger doctor doing a ward round some time ago asked me a question. He said, sir, we have 5 stages of kidney disease. Okay. How come our people in this environment present? And that takes us back to this question I just answered. That people will wait until they see symptoms. So do not wait until you see symptoms, because by the time you are manifesting those symptoms, the kidney disease is already present.
Okay, now you said, one of the major
culprits,
it's hypertension.
Hypertension.
With the kind of situation we have in this country now, fuel today is astronomical. So many things have gone out of control. Are we not particularly prone to hypertension? That's number one. And then secondly, the challenge of coming to the hospital. How easily accessible, for example, okay, you said we should do a check 3 times, advisably 3 times every year, or how accessible are these tests, and then how affordable are the tests for the common man? So those are some of the challenges, that I think. How do we navigate through them? Number one, the environment itself. Even if you had been in Lagos, I've seen some of these guys in Lagos. They wake up by 5 a.m. or 4 a.m. They don't get back to their home until 10 a.m. until 10 p.m. in the night. So within this kind of environment, I think that's even why they put our life expectancy at 50 something.
It's even 45.
It's even 45 now. So that means that we, within these circumstances, how do we now navigate and then have a healthy kidney?
Well, that is why we are doing this advocacy. Okay. Yes, there is reduced lifespan. Okay. I'm not going to gainsay the fact that stress also aggravates hypertension. Okay. Of course, hypertension could be primary, could be secondary, in which it could be genetic. But environmental factors and stress factors could also aggravate it. But with knowledge, okay, and that's why we are bridging the knowledge gap. Okay. You don't need to kill yourself. Okay. When there was no fuel, when there was no car, people were living their lives. Yeah. So I think it's because we are putting all these pressures on ourselves. So that's why we're having all these problems. And that is why we're doing this advocacy. So everybody should take it easy. Okay. So that's number one. Number two, how accessible is this? Very accessible. Okay. I'm happy to tell you that we have 3 tiers of healthcare services.
Okay.
The primary, the secondary, and the tertiary, which I work.
Okay.
The primary are those ones at the local government, those health centers. At least, worst case scenario, an individual, even in the village, can access a good healthcare by going to at least the peripheral health centers, where I am sure, at least in Ogun State today, I've been here for a while, I know that there are doctors and qualified nurses in those health centers. And of course, by the time you get to the general hospitals, which are the secondary healthcare, you have them in almost every major town or province. And lastly, the specialist state hospitals, teaching hospital, like the one in Shagamu, Hosut, Babcock, or better still, the Federal Medical Center, Abeokuta, where I work. We have very qualified hands, both nurses, doctors, and we want to bridge the gap knowledge. We know there are gap knowledges, especially in the remote setup. And that's why we are changing, we in FMC Abeokuta this year, we are changing the narratives. How? Normally, what we do screening for kidney diseases in Federal Medical Center. But over time, I found out that it is still the same set of knowledgeable people that still participate. And especially since it is free. So they take advantage to come and have it. It's the same set of either medical staffs, I mean by people who work in the Federal Medical Center, they already have access to good health. Or patients who are attending FMC already. So this year we said, no, we want community participation. So we are taking it to Jogao really. And that is, we have an outreach center there. So at least those people in the nooks and crannies in ancillary community like Iboru, Imashai, Imeko, Ayetoro, and Jogao really can actually participate in that program, in which we are going to lay our emphasis on this advocacy, health awareness, health talk on kidney diseases. We are going to teach them with a lot of our posters, so things they are supposed to be doing, and we are going to take it beyond this year. Subsequently, we want to be visiting motor parks, sawmills, garages, because these are places where people take cannabis, alcohol,
and even all
smoking,
those performance enhancing.
Performance enhancers, those are aphrodisiacs. So we will be able to take those discussions to them.
Now, every person has 2 kidneys, and at times I've seen people say, I mean, they can harvest one or maybe give someone who needs.
Very well.
So my question is, I mean, can one survive on 1 kidney, or what would be your advice to that person that believes, he can harvest his kidney, or perhaps sell one, to another person and survive on 1?
Well, the word sell, I don't know, because we don't encourage commercial donation. However, to donate a kidney, in fact, is the best. Let me say this to you. By the time you are fit to donate a kidney, you yourself, in fact, you are the best, because you will have gone through a scrutiny of investigations. And by the time, of course, to answer your question, by the time you donate a kidney, the only remaining kidney can last you for the rest of your life. The highest living donor is still alive. He donated his kidney 60-something years ago. And as we speak, he's still alive.
So which means you encourage people to
definitely.
But is it that, if it is true that you could donate, is it that in chronic cases, the 2 kidneys are packed up?
Oftentimes, it will have packed up. Because by the time it gets to that chronic and end stage, the body will have compensated. So by the time it eventually fails, oftentimes it's at end stage.
But does good diet or nutrition have a role to play in having good
very nutrition? We call it renal diet. Nutrition plays a lot of germane role, because like I said, we don't even want you to have the disease. So that's why ab initio will have been giving advocacy to eating fruits, vegetables, because these are high diets. Besides, they also contain what we call antioxidants. antioxidants.
Okay.
And antioxidants are very good, especially in stress conditions.
Okay.
So there is a lot of premium on vegetables, fruits, taking a lot of water. All these are healthy. And of course, we talk on alcohol consumption.
Okay.
If you cannot stop alcohol, you reduce your alcohol intake. Cigarette smoking is a no for kidney disease. Cannabis, totally no. Cocaine, all this, they are very toxic to the kidney. So all this we continue to lay emphasis on and encourage people not to go into that.
Many thanks, Dr. Shola ADEBISI, a consultant nephrologist, Federal Medical Center, Abeokuta. Yes, tomorrow is the day, but the whole month of March is for creating awareness on how to achieve or how to keep your kidneys safe and healthy. And you've heard from Dr. Shola ADEBISI. Many thanks for the invitation on this program.
Very thank you.
So this is where we draw the curtain on today's edition of New Dawn on Ogun State Television, where the program continues on Friday with another set of anchors. But tomorrow, the Yoruba version of the program, or Tunjo, we call it, where Tunjo and I will come your way next week, Wednesday. Do have a lovely day. Bye for now.